Hey friends, it's Dr. Vetere, and I'm continuing our lesson on how to lower the harmful levels of cortisol that may be circulating through your body due to high stress levels. The stress levels can't be any higher than what it is right now going on in our country. Now, one of the techniques for just relaxing you is to do a deep breathing exercise, and there's plenty of those you can search online. I'll show you just a simple example of what I do in a second. But the benefits of it is, one, you'll be able to learn how to expand your lung volume and also create a healthier exchange between oxygen and the carbon dioxide in your lungs. Now, the physiological effect of the deep breathing is that it will cause the vagus nerve to actually help lower the blood pressure, lower your heart rate, and subsequently just naturally lower and relax your body and lower the cortisol being released from your adrenal glands. Now, when people think of taking a deep breath, the first thing, when I go to show patients this, is they take a deep breath and they expand the rib cage, this area of their chest, to try to get as much air in. The breath I'm talking about is more of a diaphragmatic breath, and that's what that's where your vagus nerve is connected to, controlling your respiration. So when you take a diaphragmatic breath, and those who may be listening who are opera singers or just people who sing in the choir at church, in order to carry a long note, you have to have lung capacity, and lung capacity is greatly increased when you're able to take your lungs and expand them in a vertical way from top to bottom. There's definitely more room in this direction as opposed to trying to come against the rib cage. So when you take a diaphragmatic breath, what you want to do is you put one hand on your chest and one hand on your diaphragm. I'm not sure if this is going to come out on the video, but the breath comes from pushing your belly out, lowering your diaphragm, and there should be no movement really in your chest. So it kind of looks like this. And if you noticed, very little movement came at this hand, but all the movement came down at the lower end as my abdomen expanded out, dropping my diaphragm down, expanding my lungs. That's how you maximize your lung capacity. Now, one of the symptoms and signs that are going on with people with an advanced, breakdown in the coronavirus respiratory disease process is this shortness of breath. And that's why they say people who have lung issues, especially asthmatics, are more susceptible because their lungs, well, they just cannot expand because of just tightening in the lungs and the body's reaction. And one of the natural therapies that I've always recommend to my patients who are asthmatic is to practice diaphragmatic breathing to increase lung capacity. So if you're that person and if you have, what you perceive as weak lung or low lung capacity, doing this exercise will lower your stress levels, lower your cortisol levels. It will relax you, it will hyperoxygenate your blood, and improve your overall lung volume. Okay? Hope that helped. I'm Dr. Vetere, and I'm here.